Appendicitis is a medical condition characterized by the inflammation of the appendix, a small, finger-shaped pouch attached to the large intestine. While the appendix's function remains unclear, appendicitis is a well-known medical emergency requiring prompt treatment, usually in the form of surgery. If left untreated, appendicitis can lead to severe complications, such as rupture and widespread infection, peritonitis. Causes of appendicitis. The exact cause of appendicitis is not always clear, but it is typically the result of an obstruction in the appendix. This blockage can arise from various factors, including fecal blockage, fecaliths hardened stool, or fecaliths, can block the opening of the appendix, leading to inflammation and infection. Enlarged lymphoid follicles, lymphoid tissue in the appendix can swell due to infections in the gastrointestinal tract, causing obstruction. Foreign objects or parasites. Occasionally, foreign objects or parasites can block the appendix, triggering inflammation. Tumors. Rarely, tumors in or near the appendix may cause obstruction. When the appendix is blocked, bacteria within it can multiply rapidly. This leads to swelling, increased pressure, and potential rupture. Symptoms of appendicitis. The symptoms of appendicitis can vary, but the classic signs include abdominal pain. The pain usually begins around the navel and shifts to the lower right side of the abdomen. It often worsens with movement, coughing, or pressing the affected area. Loss of appetite. A sudden decrease in appetite is common. Nausea and vomiting. These symptoms often accompany the onset of pain. Fever. A mild to moderate fever may develop as the body's immune system responds to the infection. Digestive symptoms. These may include constipation, diarrhea, or an inability to pass gas. Tenderness and swelling. The area around the appendix becomes tender and swollen. Diagnosis of appendicitis. Diagnosing appendicitis can be challenging, as its symptoms often mimic other conditions, such as gastrointestinal infections or gynecological issues. Physicians typically use a combination of the following approaches. Physical examination. A doctor will check for pain in the lower right abdomen, often through palpation. Special tests, such as the rebound tenderness test, may be performed. Blood tests. Elevated white blood cell, WBC, counts may indicate infection or inflammation. Urinalysis. This test helps rule out urinary tract infections or kidney stones. Imaging tests. Ultrasound, CT, computed tomography, scans, or MRI, magnetic resonance imaging, can confirm the diagnosis by revealing an inflamed or enlarged appendix. Treatment of appendicitis. The standard treatment for appendicitis is surgery, although the specific approach depends on the stage of the disease. Appendectomy. This is the surgical removal of the appendix. It can be performed using laparoscopic surgery, minimally invasive and involves smaller incisions, faster recovery, and fewer complications. Open surgery, used in cases where the appendix has ruptured or when laparoscopy is not feasible. Antibiotics. In some cases, especially in early or mild appendicitis, antibiotics may be prescribed as the initial treatment to control infection. However, surgery is often recommended to prevent recurrence. Management of complications. Ruptured appendix. If the appendix bursts, surgery becomes more complex, and additional measures are needed to treat peritonitis or abscess formation. Drainage of abscess. If an abscess forms, it may need to be drained before surgery. Complications of appendicitis. Without timely treatment, appendicitis can lead to severe complications, including peritonitis. The rupture of the appendix releases infectious materials into the abdominal cavity, causing life-threatening inflammation of the peritoneum. Abscess formation. Pockets of pus may develop around the appendix or within the abdomen. Sepsis. The infection can spread throughout the body, leading to sepsis, a life-threatening condition. Recovery and prevention. Recovery. Recovery time depends on the treatment approach. Laparoscopic surgery typically requires a shorter recovery period, 1 to 3 weeks, compared to open surgery, 2 to 4 weeks. Post-operative care includes pain management, gradual return to normal activities, and monitoring for complications such as infection. Prevention. There is no guaranteed way to prevent appendicitis, as the condition often occurs spontaneously. Maintaining a healthy diet rich in fiber, such as fruits, vegetables, and whole grains, may reduce the risk by promoting regular bowel movements and minimizing blockages. Conclusion. Appendicitis is a common yet potentially serious condition that requires prompt medical attention. Recognizing its symptoms and seeking timely treatment are crucial to avoiding complications. With advancements in diagnostic tools and surgical techniques, most cases of appendicitis are treated successfully, enabling patients to recover fully.